It's Matt.
And Suzie.
And we're here at Suzie Health Solutions.
Yes, we are. In Wenatchee. Hi.
Now,
Matt said, you want to do a podcast? I said, okay. I have no clue what we're talking about.
Well, we are going to hit COVID and the vaccination thing kind of hard today.
Oh, man.
Well, unfortunately, because...
it's not done yet.
It's nowhere near done.
No, which we want it to be, but it's just not quite there yet.
It's largely because of the unvaccinated have been kind of running the things.
Yeah.
Throwing their hands up and say, freedom! Yeah. Man, running into that wall.
Oh, did you see the Unmask Our Kids?
Yes, we do have a local Unmask Our Kids.
Yes. So evidently they want their kids to get COVID and die.
Oh, well, yeah.
Is that a little cold?
That's a little cold.
Okay.
We've got we've been on the front lines. We were, what did they call us, workers?
Essential workers. Essential workers. Yes.
Where we didn't get paid more. We had to stay open. We had to have masks. So no, we weren't sitting on our couch eating bonbons and have a good time.
That would have exploded if he did anyway. He just does not. He's not a bonbon, sit on the couch bonbon kind of guy. Me, on the other hand, give me bonbons. I'm a happy woman.
So yeah, we've done all sorts of special enrollments for healthcare, and we're coming up to August 15th. So will be our, hopefully, fingers crossed, that'll be our last one needed.
And then we'll just roll into the regular annual enrollment in November.
Correct.
Yeah. Which is going to be extended.
Yeah, it'll be extended for that period, but we can get into that later.
Yeah, it's a whole other thing.
Hopefully, it's just our normal special enrollment of people losing coverage, people moving to the area,
standard reasons why you might, getting citizenship, all kinds of good stuff.
So let's dive into this.
Yes, we might actually get to go on vacation if it actually ends.
Well, yeah, that's
part of the conversation.
That's part of the conversation because the Canadian border has been locked down since March of last year.
That's correct, and that's perfectly reasonable.
Oh yes, because they want to prevent the spread. There are fairly large populations down here that are refusing to get vaccinated for whatever reason.
For one reason or another. Some are unable, others are just refusing.
Mm-hmm. So Canadians said, hey, you know what? We'll just cut off the tourists. It's the number 2 destination of Americans is Canada.
Yep. What's number 1?
Oh, America.
Oh, well, there you go.
We love America.
We've got a lot to see in our nation.
We got a huge amount.
We have a great tourism in America.
So right now, the tentative plan for Canada,
yes,
our lovely hat of America,
America's hat. That is so mean.
Is that August 9th? If you've gone through the full vaccination and did your waiting period of I think it's additional 2 weeks. You bring your papers. You get a COVID test negative within 96 hours or 3 days.
Right.
You're able to pass into Canada.
Yeah, and go visit Canada.
Which is kind of, it's one of those things, like I said, we plan on doing this for our son last year. We're kind of got our fingers crossed we'll be able to do this sneak across the border.
It's not sneaking.
No, it's not sneaking because we're doing with paperwork and doing it the right way. Yes. It's one of those things that most people don't understand. It's like, other countries have other rules.
And that doesn't make them less than. It makes them sometimes maybe worse. Maybe they're smarter than we are.
Well, the whole COVID passport thing.
Yeah.
That's really a political issue.
It is. See, that's where, if you want my opinion, one of the problems that COVID had, and one of the reasons why this has been so complicated in this country is because from day one, it was a political issue. When instead of a public health issue, it was a political issue.
Yes and no.
Okay. Why and no?
One of the reasons I'm gonna blame the people who have rolled over.
Well, yeah.
And what I mean by rolling over is quite clearly there was a health problem.
Yeah, big time. Public health concern worldwide.
And one of the things our governor, who handled it really well when you look at the numbers.
Mm-hmm. We could be a lot worse off.
Well, we were on the first.
We were the first state to get hit,
and and we're one of the highest in economic recoveries, and the low one of the lower infection rates.
Mm-hmm.
So he
held up
did some really good things.
It pissed off a lot of people.
However, where that ends is because in his leadership style,
mm-hmm.
he collapsed in some
He did.
He rolled over.
He did to placate some of his constituency who was ticked off because he wasn't opening businesses and blah blah blah.
And the matter is he he laid down some guidelines, some
mm-hmm.
real good. It's like, hey, if you want a business to open more,
then follow these rules.
Have a completely vaccinated area.
Mm-hmm.
And businesses didn't do it.
No. So it's still a little tricky here in Washington.
So yeah, it's there's got to be some give and take.
Yeah.
However, there's a point where the people in charge
mm-hmm.
need to say, okay, this is the route to safety. You're not going to jump back into the burning house.
There are people that will always jump back into the burning house.
They will, if it's except for literal. And I mean that. Okay. They can't visualize it that, oh my gosh, there's a problem until a breathing tube's being shoved down one of their loved one's throats.
Or their own.
Or they're saying, oh, it's too late. I changed my mind. I have a vaccine.
Well, we've heard stories. There was a guy who was a COVID denier, mm-hmm. literally hospitalized, on the verge of being intubated. Can I have a vaccine? No, it's too late.
It's too late, and we've had to use it's too late mm-hmm. with insurance more than once.
And you hate to say no, but that's exactly what that is.
Yeah, you're the it sucks to be an adult there.
Yeah, you missed your window. Grow up and deal with it.
And and some of that comes from letting the unvaccinated say, "No, we'll do what we want," mm-hmm. and that's part of the reason why it's spreading right now.
Yeah, because we'll do what we want.
We'll do what we want.
Well, the thing is, it got to the point where we were doing pretty good as a nation. Okay, you can you can take your masks off if you're vaccinated in public if you're vaccinated. Well, problem is that means those who were unvaccinated and being jerks about it. Yeah, I said jerks. Started identifying as vaccinated and lying and creating more illness.
Well,
it's spread, and the Delta variant's vicious.
Yeah, if you don't understand duty, you're going to lie.
Yeah, well, it's not an issue with these guys. They don't understand that.
Exactly. So if they failed their duty to be good Americans, so they're going to continue to lie.
Well, they think they're being good Americans. That's the concern.
No, they're not.
They think they are.
Okay.
They think they are. They think they're being patriotic. They are told they're being patriotic, and they are eating
that's where I stand in line.
I'm not saying they are. I'm saying they think they are.
And right now, as of Tuesday,
mm-hmm.
our local hospital is once again filled with COVID patients. It's the highest number since last January.
Yeah.
And I happen to be, because we get a lot of healthcare tools. It's like, okay, well, how many of our hospital systems here mm-hmm. in Washington State, how many are they requiring their own employees to be vaccinated?
I think most of them at this point, aren't they?
None.
Oh.
There's not a single hospital system in Washington State that is reported as requiring their own employees to protect their patients.
Well, that sucks.
And that that spawned, it was a big league of like 50 plus medical associations. We're talking like the AMA, the pharmacists, the pediatrics, huge monstrous groups saying, hey, you know what? You need to require your employees and anyone doing long-term care to be vaccinated.
Seems reasonable.
Because about 1 in 4 of those little rascals are running around without being vaccinated. And that's that whole duty and responsibility.
Yeah.
And clearly our local hospital systems could step up and say, hey, you know what? We're one of the largest employers in the area.
Well, okay. There was, I forget where it was. One of the hospital systems, not here in Washington, did step up and say, you have to be vaccinated. And they got such bad press over it.
Well, they didn't get bad press.
Oh, they got press.
They got press. And you've actually, I know of 2 cases. One is it's over in Idaho, and the other was the Methodist in Texas.
That's the one I was familiar with. And they ended up with a bunch of people on strike over it, and there was a lawsuit.
There was about 150 people, and they did we're going to sue because you can't do this, and the judge laughed at him and threw it out of the court. You're talking a system that was, I think it was over 15,000 employees.
Yeah. And
only 150 say, no, we're not going to do this. Yeah, freedom.
Well, then we'll just replace you. Texas is a right to work state, so bye.
So yeah, that is one of the things. So yeah, we are, have seen these surge in numbers. Our Chelan County rate is 102.9 per 100,000 new cases.
Ooh, that jumped.
Douglas County, we're looking at 180 per 6 for 100,000 cases.
180?
180.
Oy.
So it is really coming back fierce. Delta is expected to be the dominant strain.
We haven't seen Delta in our area
yet. Yes, we have.
Have we?
We have.
I thought we hadn't yet.
Yes, we've seen it in both Chelan and Okanagan counties.
Oh, swell.
It is, and over in the coast.
Yes.
8 counties have come out and said, hey, you know what? I don't care what your vaccination status is, because of the spread and because there's so many folks that are getting it.
Everyone's back to masks.
Everyone's back to masks.
I'm thinking I'm going to.
I freaking hate masks. I do.
He does.
Seriously.
He does. He hates it. That's why I'm the one that always goes to the grocery store. Seriously.
So yeah, right now, if you are in King, Pierce, Snohomish, Kitsap, Tulalip, Jefferson, San Juan, and Grays Harbors counties, as of Monday, vaccination status recommended face coverings for all those folks.
Well, I'm thinking that might be something I'll be honest. I was kind of enjoying the not wearing a mask at the grocery store. I'm thinking I'm going to start picking that back up again.
Well, rumor control has it.
That
the CDC is going to come out with a big 3:00 announcement.
Yeah, and the rumor is they're going to say what I saw was that they're going to say if you're in a hot spot. The question is, what defines a hot spot?
180 per.
I think that's qualifies.
That qualifies.
Yeah.
Unfortunately, Douglas County is the only county in Washington State that has an increase in uninsured status. It's been one of the consistently hottest for unvaccinated.
We love you, East Wenatcheeites. Just get your heads out of your butts.
So yeah, it's going to take some effort, and what it is a failure of leadership.
Yes.
It is. It is let's march into this burning house, and people are following. So that
house isn't on fire; it's just glowing prettily.
So yeah, I think that one of the other things, and this is a strain that is on the watch list. It's I'm talking about lambda.
Oh yeah, I don't know much about lambda yet.
Lambda's coming out of South America.
Yeah.
Okay. They are watching it because of 2 things. One is they know it has an increased spread similar to Delta. 2, is it might have a improved resistance against antibodies.
Ooh. So reinfection's a lot more possible.
Correct. So yeah.
How do they know? Do they know how it does with vaccines?
They're not quite certain because it came out of Peru, and because they were dealing with like a 6% vaccinated rate.
Yeah.
So it was able to spread. It's like I said, it's about 1% in the United States now. Mm-hmm. It's been seen in California and a few in cases of Washington State. I haven't seen any local. It's like I said, it's one that definitely you want to keep an eye out because it is a possibility of being really, really nasty.
Yeah.
That's what creates this is going into each body, infecting it, doing a little twist of that Rubik's Cube, and being passed on to the next body.
That's how viruses work. So here's the thing. Even if, we know that these viruses are vicious and they're mutating. Mm-hmm. We also know that right now, what we've got for vaccinations is as good as we have at the moment, and they're continuing to work on it.
Oh, they're amazing. They are literally an amazing feat of science that took over 20 years to develop.
Right. What I'm getting at here is, even if the lambda variant, for example, has vaccine resistance, you're still probably going to have a better outcome if you're immunized.
Oh, yeah.
Just for the simple fact that you will have some immunization response, not immunization, but white cell response. Your body will respond in a better manner than if you didn't have anything.
Yeah.
Basically, you're less likely to keel over dead.
Now, the other thing I wanted to, we know that vaccination is the number one defense.
It is.
Masks and social distancing, distance too. Mm-hmm. We're seeing the masks and the social distancing having to come back.
Mm-hmm. I'm so not surprised.
I
wish I were.
Well, we talked about this a couple months ago, and I said it's going to be a race.
Yeah,
it's going to be a race to be vaccinated if the vaccination is able to overtake.
That's how it works.
The stupid, because at this point it's the stupid. All 99% of the hospitalized and the dead are unvaccinated.
That's correct. Most of the people who have been affected by COVID over the last few months have been unvaccinated.
Mm-hmm. So
and with those very, very few folks who got it after being vaccinated. But it's a rare thing.
So now we're starting to see a couple. I was actually last week. A bunch of the GOP started to shift.
Yeah. Okay.
They started to shift their talking point of the freedom to, hey, you all need to get a vaccine.
Well, when Tucker Carlson, didn't he get a vaccine?
Oh yeah, he got all Fox employees got a vaccine.
Okay, Mr. Everything's bad, don't get a vaccine, all that crap that he's thrown out there is vaccinated against COVID.
Yeah.
He doesn't, don't get me started on Tucker Carlson, but okay, if you're a Tucker Carlson fan, then follow that lead.
Yeah, follow what they do and not what they say.
Yeah, follow what they do, not what they say. Let's be realistic, though. If they're
Trump's the same way.
I know. He knew he's been vaccinated.
He was vaccinated back in January.
Yeah. Well, we also know that, honestly, Tucker Carlson fans probably aren't listening to us.
I never know.
We never know. We'd like to know if you're listening to us, so pop up and say hi.
So what we're going to have to see is it's going to be more companies stepping up and saying, hey, you know what? If you want to work here, you're going to be vaccinated.
Yeah, that's
let's go all Roadhouse.
Okay.
You always be nice until it's time not to be nice. We've
Yes.
reached the time where it's not to be nice.
Yeah.
It's Roadhouse rules. I'm sorry, Dalton's right. And it's time to say, okay, yeah, if you want to work here, you need to be vaccinated.
Yeah.
The VA.
Yep, they're requiring everybody to be vaccinated if you're going to work at the VA.
It's pretty much, I think, over 500 colleges at this point
have
said, hey, you want to go to college?
You got to have the vaccine. Well, the thing is, the colleges have a history of that.
Correct.
Because they had, what's the other one?
Meningitis.
They were requiring people to be immunized against meningitis before they could attend classes.
Mm-hmm.
And so they have a well-established history of requiring vaccines.
Well, not only vaccines, but your proof of vaccination.
Proof of vaccination. And that's where, unless you have a specific medical reason,
documented medical reason
to not have a vaccine because you have an immune system deficiency, if you have this, if you have that, there's very few reasons, then I'll give you a buy. But that's why the rest of us need to be vaccinated.
Well, your employer does have the right to require it.
Yes.
And those have came out. Now, if you're out there on the dark web,
Matt loves the dark web. He just is amused as hell by it.
Oh yeah, and
no, we don't go on the dark web. We're just amused by it.
And they call their little groups onions.
I did not know that.
Yeah, and in the White House onion, nevertheless, where you can buy and sell certain things, they've actually forbidden the selling of fake
IDs,
fake COVID
vaccine cards.
Yeah, fake vaccine. So you can do all sorts of wild stuff.
Even
on the dark web.
Criminals want you to get vaccinated.
Even the criminals are saying, hey, you know what? We want you guys to stay alive. Don't be passing off this garbage.
Yeah. The bad guys want you immunized. So think about it. So if the bad guys, the people who you would classify as a bad guy, want you immunized, and you don't get immunized because you don't want to, does that make you a really bad guy?
So let's keep going. So we got.
Sorry,
we're starting to see groups that are saying, "Hey, let's make sure that more people are vaccinated, and hey, let's keep the garbage away."
Yeah,
we're going to see more of that in the real world.
Yeah, we are.
I know that there's some states that have stepped up. New York's one that said, "Hey, we're going to have our own vaccine passport."
Oh, cool! I guess cool. It's not a bad idea.
So you're going. Well, here's.
How are they going to do that, though? I mean, people commute in and out of New York State all the time.
Yeah, but what they're doing is they're making it like a phone app, so it's easy to transmit that information and display that information.
Okay, so if you go through one of the toll booths, do you have to it pings?
No, it'd be anytime you do commerce. So entering an establishment.
Oh, okay. Well, of course, we're already being tracked, so I shouldn't.
Well,
why should I be worried about that?
Here was one of the things I did not know until I looked it up. In Washington State, we're all entered into a Department of Health database.
I know. You can look on your phone. You can see it.
Yeah.
I think you can opt out of it, though.
Yeah, it takes some effort. However,
it takes a click a button.
Yeah, it takes a push of a button. However, it would have been too easy to create a little app saying, display for, a display.
Yeah, and it might still.
They might still. From all we've heard from our governor is that they don't want to go that route.
No.
However, the thing is you've got to make it easy for the people who enforce it.
Yes. And
that's the businesses.
Well, yeah, which is really unfair for people who are businesses to have to enforce this stuff.
Well, it also,
I mean, you got think about early on in COVID, there was a high school kid up at Cold Stone Creamery.
Yep.
Got absolutely bullied to the point I think she got fired over it.
Yeah, it was
because she was enforcing appropriate masking and against a couple of kids who came in, just pulled their t-shirts over their nose, and she was trying to do the job right and be the right person, and she just got hammered.
Let's bring us to the second aspect of this.
So how is it fair for someone who's just a kid to have to enforce that?
The second aspect on that is they need backup. In Canada, you're sneaking across without any, at your pay, I believe it's a $5,000 fine. It's some hardcore fines.
Oh yeah, you don't mess around with Canada in this.
And so what you need there is you need to enable the enforcers, law enforcement, to say, hey, you know what? Let's do a ticket.
But will law enforcement in Central Washington enforce that?
Well, that is the $5 question.
That is a big question for our local sheriff teams right now.
Because they've waffled many a time on masking mandates and vaccination mandates.
Anything that they think it's not just masks and vaccines; it's other stuff too. But yeah, that's a whole nother podcast.
Yeah, it's one of those ones. It's a mindset that's about a C or D for enforcement.
Yeah.
They do the bare minimum to get by and still maintain a job. And it's a tough job.
It is. I'm not arguing that.
I respect it. However, when you look at it, the number one police killer last year was COVID.
There you go.
And that is, as reported by, it was not one, but two of the police fraternal organizations. So yeah, more than the thugs killing them, more than getting stabbed, more than slips and trips on the job, it was COVID that killed police.
Yep.
And so, yeah, if they're not taking it serious, well, shame on them.
Yeah. But if you're asking them to take it serious because you need their backup and they're not there because they won't enforce these rules, what good are they?
You need to start looking at improving of police force.
I agree.
And so, yeah, we're going to have several. I just saw one the other day of a gal online saying, hey, you know what? We need to really, if we have a private party, we need to say, hey, are you vaccinated? If not, get out.
Yeah.
And that's really what it's got to be. It's like, okay, you don't have one, get out. It's not against ADA.
No, it's not.
As long as you provide alternative means to get service.
That's right. We sure do.
Yes, that was one of the first things we did. Was we actually set up to do business remotely.
Excuse me. Well, not just because of illness, but because we have a lot of people that are out of our area.
Yeah,
and we want to help them.
However, we set up to do business in that manner. So we had the alternative set up so that when it became a health issue,
we were ready to go.
It's not only we were ready to go, we had been practiced at it.
That's right, because we are proactive people.
So yeah, it's that build out, and we're going to have to see more and more businesses step up and say, hey, you know what? It just ain't worth it. My staff's all 100%, thing. Let's go 100%. If you want to set foot in the restaurant, you got to have it. I'm waiting for the gyms to do it.
That's going to be interesting because that was a very interesting subculture that was really resistant to.
Yeah, there was a fight. A fight broke out.
Yeah.
I've seen it in the martial arts community.
Yeah.
Some that looked at it, so it's like, you know what? This is no different than making sure that the mats are wiped down with quat. That's right. And some antivirals. This is just another one.
It's just hygiene.
It's basic hygiene.
Yeah.
So, to have this carried on, it's not against the HIPAA laws to ask if someone's been vaccinated.
It's against morality to lie about it.
Yeah, it's...
If you're lying to me about it, you're being amoral. You shouldn't lie to me. It's rude to lie to people.
So do you suspect you've been lied to?
Not yet. Do you?
I suspect, but it's one of those things I never ask about.
No.
Because you can always tell the truth, lie, or refuse to answer.
Yeah.
And I'll never ask you why, because the behavior will prove it out.
That's true.
So we will end it on that. So yes, go out and get your vaccine.
Yes, please. It's so easy to
There
do.
are people waved at our state numbers saying, "Oh yeah, we reached 70%," and it's like I point out, there are zip codes in this state that are 30 and less.
Yeah. Okay. Wind it up.
All right, so bye-bye for now, and have a good one. Get vaccinated, and go out and explore the world once you've been vaccinated.
That's right.
Bye-bye for now.
Bye.